Dear students, Assalamu alaikum. Welcome to my video lecture. Today my topic is the ureter. I will discuss on the ureter. Ureters are narrow, thick-walled, retroperitoneal and muscular tube which is 25 cm long and which convey urine from the kidney to the urinary bladder. Upper half of the ureter is located in the abdominal cavity and the lower half is located in the pelvic cavity. And urine is propelled along the ureter by the peristaltic contraction of the muscle coat and which is assisted by filtration pressure of the glomerulus. And this ureteric peristalsis helps surgeon to distinguish it from the uterine artery during hysterectomy. Now measurement. Let us know what is the length of the ureter. The length of the ureter, as I mentioned earlier, is the 25 cm, just like esophagus. And its diameter is 3 mm. Though the diameter is not uniform in everywhere, there are some constrictions in the ureter. Now let us know about the parts of the ureter. There are three parts of the ureter. Number one, renal pelvis, then abdominal part, then pelvic part. Abdominal part and pelvic part, these are together called ureter proper. So there are basically three parts of the ureter: renal pelvis, abdominal part and pelvic part. Pelvic part has three subdivisions. One is the vertical part, second one is the oblique part and third one is the intravesical part. Now let us know about the course of the ureter. Pelvis of the ureter is formed within renal sinus by the union of the major calyces, and then the pelvis of the ureter pass through the hilum of the kidney and exit from the kidney. Then it becomes descend downward and medially over the psoas major muscle in front of the transverse process of the lumbar vertebra and becomes abdominal part. The abdominal part begins from the level of lower pole of the kidney. Then it descends downward and in front of the pelvic brim, that is in front of the sacroiliac joint, it becomes pelvic part. This part enters into pelvic cavity. At first, within the pelvic cavity, it descends downward and backward along the anterior margin of the greater sciatic notch and reaches up to the level of the ischial spine. So this is the first part or vertical part of the pelvic part of the ureter. Then it turns forward and medially to reach the urinary bladder. This is the oblique part or second part of the pelvic part of ureter. Then it enters within the wall of the urinary bladder and obliquely opens in the lumen of the urinary bladder. So the part of the ureter within the wall of the urinary bladder is called third part or intravesical part. So these are all about the parts of the ureter. Now let us know about the constrictions of the ureter. We know that esophagus can be compared to the ureter. Esophagus is also 25 cm just like ureter, and esophagus has so many constrictions. Esophagus has 4 constrictions, but ureter has 3 constrictions. The first one at the pelviureteric junction, that is at the junction of the pelvis of the ureter and abdominal part. This junction is located at the level of the third lumbar vertebra, at the level of lower pole of the kidney. Then second constriction is at the pelvic brim, where it crosses bifurcation of the common iliac artery opposite the sacroiliac joint. And third constriction is located within the urinary bladder in the intravesical part of the ureter. So there are 3 constrictions. These constrictions are very important in case of the renal calculus or ureteric calculus. This ureteric calculus or stone may obstruct the ureter in these constricted sites. Now let us know about the blood supply of the ureter. Ureter, we can divide the ureter into three parts. The first part is located close to the kidney. We know kidney is supplied by the renal artery. So that part of the ureter will be supplied by renal artery. The middle part of the ureter, as it is crossed by gonadal artery, so it will be supplied by gonadal artery. And the lower part of the ureter is related to urinary bladder. That's why the lower part will be supplied by the vesical artery. So there are three sources of the artery for the ureter. The first part is supplied by renal artery, the middle part is supplied by the gonadal artery, and the lower part is supplied by vesical artery. Now nerve supply of the ureter. Ureter is supplied by autonomic nervous system, sympathetic and parasympathetic. Sympathetic fibers derive from the thoracic 12 to lumbar 1 spinal segment, and parasympathetic supply for the abdominal part, it is vagus. The source is the vagus nerve. But for the pelvic part of the ureter, that is the part of the ureter located within the pelvic cavity, this is supplied by the pelvic splanchnic nerve, that is sacral 2, 3, 4 segment. Now we are going to discuss about the histological structure of the ureter. As the ureter is a part of the urinary tract, it will contain 3 layers. We know that the wall of the alimentary tract contains 4 layers. Those are the mucosa, submucosa, then muscularis externa and serosa or adventitia. But in the urinary system or in other tracts like respiratory tract or reproductive tract, in those sites there will be 3 layers. Which layer is absent? The layer absent is the submucosa. So there will be only 3 layers: mucosa, then muscular layer, then serosa or adventitia. The lumen of the ureter is irregular and star-shaped. So the lumen will be irregular and star-shaped, and wall contains 3 layers. From inner to outer, these are the mucosa. Mucosa is lined by transitional epithelium. Transitional epithelium is also called urothelium. So that is the mucosa. Then under mucosa there will be a loose connective tissue layer which is called lamina propria. There will be no muscularis mucosa. As there is no muscularis mucosa, there will be no submucosa. That's why. Then second layer will be muscularis layer or muscular layer. We know the muscle is the smooth muscle. In the alimentary system, by alimentary tract, the muscles are arranged as inner circular, outer longitudinal layer. But in case of the urinary system, the muscle arrangement is just opposite. Here, inner will be longitudinal layer, outer will be circular layer. So, in the ureter, the muscle layer contain, in the most part, muscle layer will be inner longitudinal layer, outer circular layer. But lowermost part of the ureter, there is additional outer longitudinal layer. So, in the lower part, the layers will be inner longitudinal, middle circular, outer longitudinal layer. And the final layer of the ureter is the serosa or adventitia. We know ureter is a retroperitoneal structure. That means peritoneum is present on the interior aspect of the ureter. So, on the anterior aspect, this will be serosa, and on the posterior aspect, this will be adventitia, as there is no peritoneum. Now, development of the ureter. Ureter is developed from the ureteric bud, is an outgrowth of the mesonephric duct. We know mesonephric duct is also called Wolffian duct. Now, layer-wise development. Lining epithelium of the ureter develops from the intermediate mesoderm, and rest of the layer develop from splanchnopluric layer of lateral plate mesoderm. And now we are going to say some words about the developmental anomalies of the ureter. Ureter may possess some developmental anomalies like bifid pelvis or bifid ureter, megaloureter. When ureter is congenitally dilated, this is called megaloureter. Then ureter may pass behind the inferior vena cava. That condition is called retrocaval ureter. And that is all about my discussion on the ureter. I think this video will help all the students to understand the anatomy as well as the histology and development of the ureter. So thank you very much and goodbye.